In a recent discussion surrounding healthcare, Republican vice presidential candidate Senator J.D. Vance made some bold promises about covering individuals with pre-existing conditions, claiming a commitment to ensuring that everyone has access to essential health services. His comments followed a debate in which former President Donald Trump hinted at a new healthcare plan that remains largely undefined. Vance stated that the approach to health coverage would involve promoting more choice and deregulating the system, allowing people to select plans that best meet their needs. However, the context behind Vance's assertions raises significant questions. His claim that pre-existing conditions would be adequately covered while removing certain Affordable Care Act, that is ACA, regulations lacks nuance. The ACA, widely known as Obamacare, was pivotal in mandating that all individuals be placed into a single risk pool. This system prevents insurers from charging higher premiums to those with chronic health issues, a feature that has been crucial in protecting millions of Americans who previously faced discrimination in the health insurance market due to their medical histories. Before the ACA's implementation, many Americans with pre-existing conditions found themselves either denied coverage entirely or subjected to exorbitant premiums that rendered insurance unaffordable. Approximately 54 million Americans were affected by these barriers prior to the law's enactment. Vance's advocacy for separating individuals into different risk pools could result in significantly higher costs for those with chronic illnesses, thus undermining the very protections that many have come to rely upon. Experts warn that without substantial government intervention to support these high-risk groups, it would be nearly impossible to safeguard access to affordable care. In his comments, Vance also reiterated a recurring theme among many Republicans, the desire to shift away from the ACA's regulatory framework in favor of a more market-driven approach. While proponents argue that such deregulation would enhance choice and lower costs for healthier individuals, the potential ramifications for those who are not in good health are troubling. The reality is that high-risk pools, as previously attempted, often fail to provide adequate coverage or affordability for the very individuals they aimed to assist. These pools historically offered limited benefits and incurred substantial losses, making them a less viable option for sustainable healthcare reform. Moreover, Vance has not clarified how he would ensure that the most vulnerable populations receive the necessary financial support if his proposed changes were to be enacted. Critics argue that if his plan does not include robust federal assistance, it would leave millions of Americans worse off, particularly those battling chronic illnesses. As the healthcare debate heats up leading into the upcoming elections, it is imperative to scrutinize the implications of these policy proposals closely. While the promise to cover pre-existing conditions is appealing, the mechanisms proposed to achieve that goal must be transparent and effective. The future of healthcare access for millions hangs in the balance, and voters must be informed of the true nature of the changes being advocated by political leaders. The discourse around these issues is critical, and it's essential that we continue to advocate for systems that prioritize the health and well-being of all Americans. Stay subscribed for more videos.